More than half of adults over the age of 60 are living with health conditions that didn't appear overnight. In many cases, the warning signs were there for months, sometimes even years, quietly showing up in small ways most people never thought to pay attention to. And one of the most overlooked places those signals appear is somewhere you probably looked at this morning without giving it a second thought: your nails. They may seem insignificant, something purely cosmetic, but your nails are constantly reflecting what's happening inside your body. Changes in circulation, oxygen levels, inflammation, nutrient balance, even stress on major organs can all leave traces there long before more obvious symptoms begin. The surprising part is that this isn't new information. Medical researchers have documented these connections for decades, yet most people still have no idea what they're looking at. And after the age of 60, these signals become even more important because the body becomes less able to hide internal problems the way it once could. That means subtle nail changes can sometimes carry more meaning than people realize. Today, we're walking through 7 nail signs that could point to deeper health issues, and some of them are far more serious than they appear at first glance. One of them in particular is so commonly ignored that many people mistake it for nothing more than normal aging. But before we get into the list, take a quick look at your own hands right now, because by the end of this video, you may notice something you've never paid attention to before. To understand why these nail changes matter, you first need to understand what your nails actually are. Your nails aren't lifeless surfaces sitting on top of your fingers. They're produced by living cells deep beneath the skin in an area called the nail matrix, and those cells rely on a constant supply of oxygen, nutrients, proteins, and healthy blood flow to grow normally. In other words, your nails are being built in real time by whatever is happening inside your body. If circulation slows, if oxygen levels drop, if inflammation rises, or if certain organs begin struggling, your nails can start reflecting those shifts long before you feel dramatic symptoms. Think of them almost like a biological timeline. Every millimeter of nail growth contains clues about what your body was dealing with when that section formed. And this becomes especially important after 60 because the body's ability to compensate quietly starts to narrow. In younger years, the body can often hide dysfunction for a long time. But with age, those hidden imbalances become harder to mask. That's why certain nail changes in older adults can carry surprisingly strong clinical significance. Now, that doesn't mean every unusual nail is automatically dangerous. Plenty of harmless things can affect nail appearance. But when changes appear gradually, persist over time, or occur alongside fatigue, swelling, breathing problems, or circulation issues, they deserve attention. And the first sign on this list is one that many people normalize for years, without realizing it could be connected to something much deeper happening beneath the surface. The first sign is called clubbing, and once you know what it looks like, it becomes very difficult to unsee. Clubbing happens when the tissue beneath and around the fingernail slowly begins to thicken, causing the fingertips to appear enlarged or rounded. The nails themselves often curve downward more dramatically, almost creating the appearance of an upside-down spoon. What makes this sign so deceptive is how gradually it develops. Most people don't notice it happening because the changes occur little by little over months or even years. Many simply assume it's part of aging, arthritis, or just the natural shape of their hands. But medically, clubbing has long been associated with chronically low oxygen levels in the blood. That means it can sometimes appear alongside serious lung conditions, heart disease, and certain digestive disorders. The body, struggling to deliver enough oxygen efficiently, begins altering blood flow and tissue growth at the fingertips over time. Imagine noticing your hands every day in the mirror and never realizing they've changed because the process was so slow. That happens more often than people think. In some cases, family members notice the difference before the person themselves does. One of the easiest ways to check is by looking at your fingers from the side. Normally, there's a slight angle between the nail and the skin beneath it. With clubbing, that angle can disappear, while the fingertip itself begins looking fuller or puffier. And while clubbing alone doesn't confirm a diagnosis, it absolutely deserves medical attention, especially if it appears alongside shortness of breath, chronic coughing, unusual fatigue, or reduced exercise tolerance. Because sometimes the body whispers long before it ever starts shouting. The second sign is something called Terry's nails, and this one catches many people completely off guard because it doesn't look dramatic at first glance. Instead of appearing healthy pink, the nails become unusually pale or almost completely white across most of the nail bed, leaving only a thin, darker band near the tip. Some people describe them as looking washed out or cloudy, as though the natural color underneath has faded away. What's happening beneath the surface is believed to involve changes in blood flow and tiny blood vessels under the nail bed. And over the years, researchers have linked Terry's nails to several conditions that become increasingly common after 60, including liver disease, heart failure, diabetes, and chronic kidney problems. What makes this sign especially important is that many of those conditions develop quietly. They don't always announce themselves with severe pain or dramatic symptoms early on. A person may feel slightly more tired than usual, notice mild swelling, or simply assume they're slowing down with age while the body is already under strain internally. That's why nail changes can become such valuable clues. They sometimes reveal what the body hasn't fully said out loud yet. If you notice that your nails have lost their normal pink tone and appear consistently pale or opaque over time, especially across several fingers, it's worth paying attention to. And the next sign we're about to discuss is closely related, but with one very important difference. Because unlike Terry's nails, this next condition creates a visible dividing line across the nail itself, and that detail can point doctors toward a completely different organ system altogether. The third sign is known as Lindsay's nails, sometimes called half and half nails, and the name describes them perfectly. The lower portion of the nail near the cuticle appears pale or whitish, while the upper half closer to the fingertip becomes noticeably darker, often reddish-brown or pink. A distinct horizontal separation forms between the two colors, almost as if the nail has been divided into sections. And while many people assume this is simply discoloration from aging or pressure, the medical connection behind it is much more significant. Lindsay's nails have been strongly associated with chronic kidney disease, particularly when kidney function has been declining quietly over time. The reason this matters so much after 60 is because kidney problems are incredibly common and often develop with almost no warning signs in the early stages. Unlike other organs, the kidneys can lose a surprising amount of function before noticeable symptoms appear. Many people feel completely normal while filtration capacity is already decreasing in the background. That's why subtle physical clues matter. They may become visible before someone ever realizes there's an issue. People with diabetes, high blood pressure, or cardiovascular disease are especially important to monitor because those conditions place additional stress on kidney function over the years. If you notice a clear horizontal division across several nails that doesn't go away, it's worth mentioning during a medical appointment, especially alongside fatigue, swelling, or changes in urination patterns. But the next sign on this list may be even more surprising because unlike color changes, it appears as physical grooves across the nail itself, almost like your body pressed pause on nail growth for a period of time. The fourth sign is called Beau's lines, and these are one of the clearest examples of your body leaving a visible timestamp behind. Beau's lines appear as horizontal grooves or dents running across the nail from side to side. They can be shallow or deeply pronounced, and sometimes they affect multiple nails at once. What causes them is a temporary interruption in nail growth. At some point, the cells responsible for producing the nails slowed down or stopped functioning normally for a period of time, usually because the body was dealing with significant internal stress. That stress can come from severe illness, uncontrolled blood sugar, high fever, major surgery, nutritional deficiency, or other serious physical strain. What makes Beau's lines fascinating is that nails grow slowly and consistently, which means the location of the groove can roughly estimate when the disruption happened. A line sitting halfway down the nail may reflect something your body experienced several months earlier. In some cases, people remember being sick once they connect the timing. But in others, the lines reveal stress the person never fully recognized in the moment. And after 60, that matters because the body sometimes struggles silently before symptoms become obvious. Repeated Beau's lines on multiple nails can suggest recurring stress events inside the body, particularly with blood sugar instability or chronic inflammation. Many people dismiss these ridges as harmless cosmetic changes, but patterns matter. If the grooves keep returning, deepen over time, or appear alongside fatigue, weight changes, or worsening diabetes control, they deserve attention. And the next sign we're about to cover may be one of the most underestimated of all because it often begins with something people mistake for nothing more than fragile or oddly shaped nails. The fifth sign is called spoon nails, medically known as koilonychia, and the name comes from the unusual shape the nails begin to take on. Instead of curving gently downward like healthy nails normally do, the center starts dipping inward, creating a shallow concave surface, almost like a tiny spoon. In more advanced cases, a small drop of water could actually sit in the depression without immediately rolling off. It's one of those changes that seems minor until you understand what it can reflect internally. Spoon nails are strongly associated with iron deficiency anemia, particularly when iron stores in the body have been low for an extended period of time. And for adults over 60, that connection becomes especially important because anemia at that age often isn't just about diet. Sometimes it points toward chronic blood loss, absorption problems, or underlying conditions affecting the digestive system. In other words, the nails may not be the real problem at all. They may simply be revealing that something else in the body is quietly draining iron over time. What makes this sign dangerous to ignore is how easy it is to explain away. People often blame aging, manual labor, detergents, or years of wear on the hands. But when spoon nails appear together with fatigue, shortness of breath, dizziness, pale skin, or reduced stamina, they deserve proper investigation. In some cases, identifying iron deficiency early leads doctors to detect problems that otherwise might have gone unnoticed for years. And now we come to a sign that looks much smaller on the surface but can sometimes point to something far more urgent happening inside the cardiovascular system itself. The sixth sign is called splinter hemorrhages, and despite the name, they don't actually involve splinters at all. These appear as tiny dark red or brown lines running vertically beneath the nail, almost like someone drew thin marks under the surface with a fine pen. A single one after bumping your finger usually isn't a concern. Minor injuries happen all the time, but when several appear across multiple nails without any clear trauma, doctors pay much closer attention. That's because spontaneous splinter hemorrhages can sometimes signal inflammation or damage occurring inside the blood vessels themselves. In more serious cases, they've been associated with infective endocarditis, a dangerous infection involving the inner lining of the heart. What makes this condition especially concerning is that the early symptoms can seem surprisingly mild. People may feel tired, achy, slightly feverish, or just off for days or weeks before realizing something more serious is developing. And in older adults, those vague symptoms are often mistaken for exhaustion, aging, or minor illness. That's why these tiny lines under the nails can become such important clues. They may be one of the few visible warnings the body gives early on. Splinter hemorrhages can also appear with certain autoimmune and vascular conditions where inflammation affects the circulation system. The key detail is whether they appear repeatedly, on multiple nails, and without obvious injury. If that happens alongside fever, fatigue, shortness of breath, or recent medical or dental procedures, it's something that should never be ignored, because sometimes the smallest signs on the surface are connected to the most serious problems happening underneath. And the final sign on this list may be the most overlooked of all, because millions of people mistake it for a simple cosmetic issue when it can actually point towards several systems in the body struggling at once. Here's the most important takeaway from everything we've covered today. These signs are not meant to make you fearful. They're meant to make you aware. Your body is constantly communicating with you, and your nails are one of the few places where internal changes can sometimes become visible before more serious symptoms appear. That doesn't mean every ridge, discoloration, or unusual shape points to a dangerous condition, but patterns matter, persistence matters, and combinations of symptoms matter even more. So starting today, take a closer look at your hands under natural light. Pay attention to the color of your nails, their shape, their texture, and how quickly they seem to grow. Notice whether changes are affecting one nail or several. Take photos if something stands out so you can compare over time. And if you recognize any of the signs from this video, especially alongside fatigue, swelling, breathing changes, circulation issues, or unexplained weight loss, bring those observations into your next medical appointment, not because you're diagnosing yourself, but because informed observations help create better conversations and earlier investigations when necessary. The reality is that many serious conditions become far more manageable when they're identified early, and one of the biggest advantages of getting older is experience. You know your body better than anyone else. You notice when something changes, even subtly. The key is learning which changes deserve a second look instead of being brushed aside. The nails you barely noticed this morning may actually be revealing far more than you realized, and now, when you look at them again, you'll know what to watch for.